So Sunderland Culture applied through the Thriving Communities Fund to set up a partnership with Groundwork North Eastern Cumbria, Sunderland Carers Centre, the GP Alliance and Equal Arts that would test and explore social prescribing activity. Sunderland Culture managed and applied for this fund because we, with the partners, understand the impact that arts and culture and nature can have on mental and physical health and well-being.
Social prescribing is a term used widely. It isn't a new process, it's been around for over 25 years. You've got longer term companies using social prescribing, people like Aged Care, Sunderland Carers Centre, but it's very new to the NHS. It started in 2019 and it is a way of trying to divert patients away from GP practice doors for non-medical interventions.
It's not only about sorting problems and, oh yes, you need this and you need that. It's also thinking out of the box. How can we make a change in this person? How can we change the lifestyle? Not only stop smoking, alcohol, but also how can I make you a happier person? We all need to have fun.
It's really hard sometimes to put into words that feeling that you get when you're taking part in a pottery class and you just head down and you've forgotten everything, or a theatre performance, for example, or a dance class where you're just engaging with people and you're laughing and you're moving your body. And we are interested in sharing that impact, and sometimes the only way to share it is to get people to try it. And once they've tried it firsthand, we hear about the impact that such activities can have. It's a lifeline for some people.
And I've been a member since it started 6 years ago when my husband and I joined. My husband, Reg, had dementia and he died in 2017. But this group meant a great deal to him and to me and allowed us to just be two people, not a carer anymore, just two people. We've been very fortunate that the artists who've come to us not only were professional in their skills, but also had had training in dementia. Reg actually died on a Friday, which was the group day, and I actually came up here on the Friday afternoon so that I could tell the group. That's how important it was.
We know social prescribing works because we hear it from the voices of the people who's attending these sessions. You know, it's these people who have been socially isolated and are now coming out into the community. They are struggling with their health, their mental health. Attending these sessions has benefited them so greatly.
We're essentially all delivering social prescribing activity in one way or another, but we haven't formalised that, and that's what this partnership was about. How do we link what we do, let people know about it, improve the offer, upskill our artists? How do we make sure that we're meeting the needs of people and individuals, and then how do we let GPs and healthcare know that we are here, that we exist?
For me, any kind of partnership is important. Being on the Thriving Communities Partnership has been a huge benefit to our residents, our patients across the city, including patients in care homes. There's no exclusions, and it's about working together to get the best outcomes for that person.
I think the biggest success for this project is collaboration. So we've met now with more GPs. We understand about how people are referred to social prescribing, but we've also met some very passionate professionals who really believe in social prescribing, who want to connect with the partnership and who want to help us to share the message about how important this is for people's health and well-being. We now understand each other more fully, what we offer, what the challenges and barriers are, and we now are working together to overcome those.
It's not really medicine that I can prescribe to ease their problems. If you're feeling a little bit anxious because of money, so shall I give you some tablets? I don't think this is a solution. Actually, it's creating a burden with the side effect of tablets, etc., and the real problem and the root causes hasn't been resolved. But social prescribers have these patients to get their problem solved.
So what we've tended to do is talk to link workers and GPs about some of the health inequalities or some of the issues that they see that are being faced by patients, and then tailor a programme around it. So we haven't been shy in trying out new things.
Lots of people have come in over the last week feeling quite agitated or quite low mood, and through taking part they've managed to leave the room smiling, or they've given verbal feedback in some cases, or they've just not wanted to leave.
From the experience I've had with Sunderland culture, I look to try and use the creativity that we learn from the arts and the benefits that those sorts of things bring, and try and allow that to develop the way that I work, and hopefully we can make social prescribing the norm.
We're so grateful to Thriving Communities for the funding that we've received and used over the past year. It's allowed us to develop a partnership that have tested and explored social prescribing, what it is, what it does, how it happens and who it serves. And it's brought together a collaboration that hopefully we can continue on into the future.